Welcome to What's New, your channel for everyday solutions.
Be sure to subscribe, share and like our videos. This is What's New.
Google's health cards to combat unreliable health information online by Vijay Kuhn. Thanks to the internet, health information is now at our fingertips, and while health professionals make use of the technology to access up-to-date medical information on the go, the public, too, often takes the advantage to search for symptoms, self-diagnose and sometimes even self-treat. Unfortunately, the convenience offered by the internet does not always translate to accuracy, as there are plenty of unreliable web sources as there are trustworthy ones. The open access to unvetted information is frightening, and may result in propagation of misleading facts as well as dissemination of fake news, which ultimately lead to preventable harm in patients. Aiming to provide accurate basic information for common conditions. 1 in every 20 Google searches is for health-related information, and a survey by the NPS MedicineWise revealed that 20% of Australians use Facebook as a go-to source for their health-related queries. As an antidote to the potential dangers of unreliable information, Google has launched Health Cards, a feature designed to answer users' queries about health with verified medical information in Australia. Starting today, when Australians search for common health conditions, such as asthma, they will start to see health cards appear in their search results, said project manager Isabel Salekwa. Similar to its US version that was launched in 2015, Health Cards reveals outlines of symptoms, diagnosis, treatment pathways and other relevant information of over 900 health conditions and diseases searched by users. Some cards also have pictures or diagrams created by licensed medical illustrators. These health cards are meant to provide basic information about health conditions and a framework to help users dive deeper across the web and do deeper research as well as to have more informed conversations with their doctors, Salekwa said. Developed mainly by medical professionals. Health Cards was developed with the expertise of medical professionals led by cardiologist Dr. Kapil Parakh as well as doctors from Mayo Clinic, who carefully gathered, curated and reviewed the most relevant and accurate information for use in the feature. Developed to provide relevant information that doctors would want their patients to see, pharmaceutical companies and commercial healthcare providers were not involved in the development of the feature, said Salekwa, so when searches are made, health cards provide treatment options, but do not recommend specific medications. Instead of trying to pretend that that isn't a problem and that people aren't finding bad information on the internet, what the health cards are meant to do is provide accurate and reliable information created in a partnership with medical doctors and to make sure there is a source of information online that people can trust, she said. Technology should not replace qualified medical opinion. According to the chairman of the E-Health and Technology Committee of the Royal Australian College of General Practitioners, Dr. Nathan Pinskier, Health Cards holds potential for improving accessibility to refined health information online, but a quick Google search may inadvertently intensify the concerns of hypochondriacs and heighten the anxiety level in these patients. There is no question people need to be able to access reliable health information. The question becomes what makes a difference to patient health at the end of the day? He said. On the flip side, others may be quick to dismiss symptoms that may actually indicate a more concerning health problem. As it stands, 3 out of 5 Australians substitute health information on the internet for a consultation with a qualified medical opinion. And while Australian Medical Association Federal Vice President Dr. Tony Bartoni thinks that health cards may improve health literacy, he has cautioned for users not to be wholly reliant on such online features. You can use tools like this to improve your questions, but, at the end of the day, if you've got a condition which is not improving and is causing you distress, you should always follow up with your doctor. He said. There are things your technology will never diagnose. Salekwa has also stressed that Health Cards was in no way meant to provide medical advice, but instead, intended to provide safer and more accurate online information to the public and should not replace the expert opinion from a real doctor.
Welcome to What's New, your channel for everyday solutions.
Be sure to subscribe, share and like our videos. This is What's New.